amazing speaker with us. And this is none other than Dr. Shridhar, an oncologist and a specialist with cyberknife treatment or cyberknife therapy. We are going to have a very, very interesting conversation with Dr. Shridhar, who is currently in Bangalore. Minla tries and brings different speakers on this platform called the Minla Zoom sessions that is being transmitted globally via Instagram, via Facebook, via Zoom, people who are directly logging in. And ladies and gentlemen, we are truly proud to say that we are on our 107th session, 107th session of our Minla Zoom. We started during COVID, that started in the pandemic that started in the year 2020. And we are now going strength in strength with the 107th session today. And it has been an amazing journey for us, for both Meena Ben and myself. Minla, which is Meena Ben Kagram, and myself, Dr. Lalit Soda. So this is the team that started the Zoom sessions in 2020 and are absolutely enjoying the journey. We have come far and wide for the audience and for ourselves also. Now, today we are truly delighted. As we said, we are having this wonderful speaker from Bangalore who's going to be sharing his optimal knowledge about oncology and cyberknife and what is the big treatment, what's the big therapy about, what are the conditions that can be treated, the good effects, the not so good effects. We've got a lot of information to share with you. But before we do that, let me very, very quickly tell you a little bit about this wonderful gentleman who is Dr. Shridhar, who is currently based, as we said, in Bangalore. Dr. Shridhar's qualifications are, I'm going to rhyme out a few alphabets. He's an MBBS, an MD, a DNB, and an MNAMS. We'll soon find out what all those letters mean. Just trying to see if everybody knows the alphabet, and I think everybody does. So, Dr. Shridhar, we're going to be asking you very shortly, what is this MNAMS stand for? But we are going to say his current position is he's the director of CyberKnife, a professor, a senior consultant in radiation oncology in the Healthcare Global Enterprise. He's also at the Gokul Curie Center of Oncology, and he's also at the HCG, the Holy Cross Road IC Colony of Borivali, Dahisar. He's also connected with them. His main qualification, as we said, the MBBS is from the Government Medical College of Mysore in India, and year of passing, 1996. So we're not talking to a very, very old gentleman. He's a very new with modern ideas, modern techniques. MD in radiotherapy and oncology. He graduated from the Institute of Medical Sciences in the Banaras Hindu University in Varanasi in India. This was in July 2002. Doesn't stop there. He gets a diploma in the NB Radiotherapy and Endocrinology. All India Institute of Medical Sciences in New Delhi awarded him that. And that was in December 2003. And he then became this is the MNAMS. He's the member of the National Academy of Medical Sciences from the All India Institute of Medical Sciences in New Delhi. And this was in 2005. This gentleman has had amazing number of papers that have been published, amazing amount of research that he's done. The whole bio is about 7 to 8 pages long. And I'm not going to acknowledge every paper or every research, but let me tell you, ladies and gentlemen, this gentleman is a walking, talking encyclopedia on cyberknife and oncology. So here we are presenting Dr. Shridhar from Bangalore. And we are truly delighted to have him in our Minla Zoom session. And what I'm going to do right now is introduce to the Iron Lady of Minla Zoom, who is none other than super duper beautiful Mrs. Meena Ben Kagram, who is currently in Nakuru, and she's hosting the session from there. And she is the lady of the Minla Zoom. And I warmly welcome Meena Ben Kagram on the Minla Zoom session. Meena Ben, we welcome you, and please continue with your traditional welcome to our wonderful speaker, Dr. Shridhar.
Shridhar bhai, namaste.
Namaste.
Nice. Thank you very much for coming. Shridhar bhai, this is for you.
A tilak.
Tilak and chokha, and we officially welcome you to Nakuru and London and to our Zoom. And this is for you.
Oh, so nice.
Very grateful. Jambo. Karibu.
Asante sana.
Good evening, ladies and gentlemen. Welcome to our very unusual speaker, Professor Dr. Shridhar. Humble, helpful, and he answers calls any time of the day for the anxious patients. Welcome to the flamingo city of Nakuru, where Lake Nakuru is famous for wildlife and flamingos. Nakuru County is the one where world-famous fastest runners like the first Eliud Kipchoge marathon runner, Eliud Kipchoge's Kiano fastest runner, Faith are born here. We all also have first African James to climb the Mount Everest last year. We have very old Hyrex Museum and world-famous crater too. This is where World Safari Rally starts. Nakuru is the fastest progressing city in the world. It is city of opportunity. My cute cousin, Dr. Lalit, and myself, Minla Zoom, are super excited to welcome you all and here who have joined on Minla Zoom and on Facebook Live. Karibu, Biwi and Dwana. Let me introduce to you our backbone of the session, MC Dr. Lalit Soda. He is a professional speaker, chiropractor, and author. He is a recipient of many awards, been awarded Marwa Journalist Award and Lohana Mahaparishad Journalist Award. And do you know, ladies and gentlemen, what he bagged recently? One more humanitarian award at London Parliament. Over to you, Lalit.
Thank you very much, Meena, when you're saying too many good words about me, but I truly appreciate it. Thank you very much for that, Dr. Shridhar. We are truly excited. Meena Ben has done a traditional welcome to you on our Zoom platform, and we all, with the audience and the host, Meena Ben and myself and Ali, we welcome you warmly on Minla Zoom. So, Dr. Shridhar, a couple minutes for you to share that you are currently from Bangalore. You are sitting at your home in Bangalore and giving us this wonderful session. We'll give you a couple minutes to just have a share about the Minla Zoom, about yourself, and then we'll engage into our questions and answers.
So, first of all, thanks a lot. I'm definitely honored to be here, and that's a traditional welcome. And Meena ji and Lalit ji and all the viewers and people it's on Facebook and all the platforms what are there. It's my it's Namaste from Bangalore. So as we're rightly talking about, we are connected with the 3 different continents to right now. And when Meena ji talked about that, to share my experience about the Minla platform, I told I'll be honored, and I'm going to be part of it. That's what I said, and that has come true. I'm really, really grateful to you guys.
Thank you very much, Dr. Shridhar. Now, obviously, we've got audiences from all over the world. I can see a few already on Zoom logging in from Kenya. There's a few people from Dubai, from Kenya, for sure, from London also, and from India. So we've got an international presence over here already on Zoom, and this is also live on Facebook. So we have a lot of audience who are very keen and curious to find out about this magic word, cyber knife. So before we start into anything, just explain, define the term cyberknife. What is it? Just open up the topic for us with a brief definition of cyberknife.
Okay, so let me introduce myself in a professional way. I'm a cancer specialist. Like in cancer, if you talk about cancers, we know that cancer is an abnormal growth which comes in any part of the body. So once it is done, then we'll think about like what is the line of treatment. There is a surgery, there's a chemotherapy, and there is a radiation. So I'm a radiation oncologist. So radiation, like it's radiation, we give radiation to any part of the body. In radiation, where there is one the specific machine is called cyberknife. So the cyberknife is a very sophisticated machine. The trade name is cyberknife. It is a robotic radiosurgery we call. So the radiation machine is attached to the robotic. Conventionally, we had a very difficulty in treating many of the areas accurately all the time because the organ will be moving, tumor will be moving, and the patient will also be moving. So we tackle all these movements and focus the radiation to a particular area of interest. So, and it tracks continuously and it delivers the treatment very effectively. Because of that, the treatment related side effects becomes less, the effectivity of the treatment is better, the quality of life increases. So that's in a nutshell. The cyberknife is a robotic radiosurgery linear accelerated radiation machine. So I'm specialized in that. So that is what it is.
Wonderful. Thank you very much. So to begin off with a few questions, and I will encourage the audience, if you want a specific question to be addressed, please put it on chat box. We will definitely address it, time permitting and the question permitting. So if you have any questions, just put it on the chat box. We'll definitely take it on. The first question you briefly mentioned about a cyberknife being a robotic way of doing this treatment. When did cyberknife first when was it first implemented?
So the cyberknife, as I told you, the radiation as a part of the treatment is there for almost now, like the X-ray part of is diagnosed 100 plus years. The therapeutic radiation came for almost around 5 to 6 decades now, 7 decades. The cyberknife specifically came for around 15 to 20 years, around 20 years. It's probably in around 1985, 90, around 1990. So this is actually, if you tell the story of the cyberknife, there is a gamma knife. The gamma knife is a radiation machine where a neurosurgeon uses only for the brain tumors. There is a guy called Dr. Lexell, that is his brain child, where he used to do wherever there's an inaccessible lesion, especially for aneurysms and the AV malformations, he used the multiple gamma rays to focus on a particular area. So that is a gamma knife. Dr. Adler is a neurosurgeon who was working with the Lexell, improvised this, and then he told that there are some of the problems with the gamma knife. We need to fix the bone, the brain, the head part of it so that the head doesn't move. So what Dr. Adler did is use the robot. This is actually an industrial robot. He went to the industrial robot, like can see that accuracy of the treatment, and the areas can be tracked accurately to a span of sub-millimeter accuracy in whatever the directions that the tumor or the head moves. We can track those areas and deliver the radiation to very, very precise in an all of a like more than 360 or like a global manner. So into a pinpoint precision. So this is what Dr. John Adler started this in 1990s. And this technology was there only in US, like it is. Then actually in India, we have for last 13 years. So we got the technology 13 years back, exactly in like in July 25th, 29th, actually, we treated first patient in 2010. So we are 13 years we are doing, and we have done almost 5,000 odd patients, probably highest in the by one in the private sector. And I have contributed more than 3,500 to 3,800 cases
Wow.
to my credit. So probably highest by the one person at an average of around 360 every day, one patient. That is what I will call it as.
Amazing.
So that is what.
So let me ask you, Dr. Shridhar, would you be one of the first personalities in India that implemented CyberKnife?
Yes.
So a pioneer in India would be yourself.
Yes, I think like the people will definitely accept. I'm also called a CyberKnife man, like it. So they not like all my friends they tease me in a different names. Like one of my close friends always tells that Sridhar can boil the milk with the CyberKnife. So that means like it is synonymous with the in India definitely the my name is associated with CyberKnife.
Okay, so Dr. Cyberknife, if I may call you. Can I ask you?
Yeah.
So Minda will give you that name, Dr. Cyberknife. So we'll ask you, Dr. Cyberknife, if the medical profession is amazing and it's so research backed, and there is amazing number of papers and research backing many kinds of treatments. We can't say that about COVID as yet because it's only 3 years old. But about CyberKnife, we would love to ask you that though it's only 13 years old in India, how much research can we rely on and say for certain that yes, this is the research that has been done, this particular cancer has been treated by CyberKnife and has proven to be extremely successful? Could we say that with the 13 years of implementation of CyberKnife?
Yes. So the coming to that, what are the areas we can treat with the CyberKnife?
Correct.
So it is started as the benign tumors, like it can treat the benign tumors, malignant tumors. So I'm sure that you're just to go take one step backward and tell that what is a tumor? Tumor is an abnormal growth any part of the body. So it may be, we call it as the benign tumors and the malignant tumors. Benign tumors are well encapsulated. There may be small swelling which is there for years and it grows slowly and it does not cause much of the harm. But because of its functions, means it may secrete some of the things abnormal so that we have to treat, like simple as the pituitary adenoma. So it's a benign tumor, and meningiomas is one of the brain tumors is a benign tumor. So the surgery, if the patient does not want surgery or if it recurs, we can go and treat. In the other side is the malignant tumor where it's synonymous with cancer. Like that is where we tell that the tumor may come up with a small area, it as a lump, bleeding, or it may be weight loss, or it goes as a potentiality to go to other place. It is called malignancy. So the CyberKnife can be used radiation. It is nothing but a radiation machine with a very high precision. It can treat both benign tumors and malignant tumors. In benign tumors like AV malformation, that is a congenital malformation, and pituitary adenomas and meningiomas and the small tumors, it has been established beyond doubt. And this, like acoustic schwannoma, it is a curative in nature. So we must have treated across the world the schwannomas and AV malformation benign tumors. Maybe millions of patients must have been treated and established. That is curative in nature. So then comes in the same manner, there is even in functional disorders like trigeminal neuralgia, where there's a very facial pain occurs, the CyberKnife is established. There's a pain which occurs which is not coming down with any of the medications, not even with surgery. We give very ablative technique called with the CyberKnife very precisely to the trigeminal nerve, and we ablate that. That's like a cutting the nerve. So then comes the malignancy. In malignancy, there may be early malignancies or locally advanced, or it may be advanced. In these cases, especially now, like it's a pancreatic cancer. Yes, it's a curative in nature where we can consider it as a CyberKnife is one of the established treatments. Prostate cancer, where patient does not want to do it, it is now established beyond doubt that it is a curative in nature as alternative to surgery, or where the patient does not want surgery at all. So these are some of the cancers. And liver cancer. So like you can take, now it is also extended to a advanced tumor where surgery is not possible, or a tumor has come back after the treatment. So the CyberKnife is very effective in these areas. And even in the multiple tumors, even in the stage 4, now recently we call it as oligometastasis. In combination with the other things like immunotherapy, medical oncology, it has given a very good result. We call it as a survival benefit, not only as a local control, increases the quality of life, and the patient survival is also increased.
Amazing. So just catching up on your conversation, and before I go to catch up with your conversation, I must welcome one of the doctors from Nigeria who's actually joined in, Dr. Baba Ahmed. He's actually logged in from Nigeria, West Africa.
Oh,
yeah.
yes.
So that's amazing. Welcome, Dr. Ahmed. And we have got a wonderful, what I would like to say, a young gentleman, Mr. Manubhai Chandaria from Kenya, who we will be bringing him on at a later part of this session because he wants to converse with you a little bit about introducing CyberKnife in one of the hospitals. So we'll talk about those two gentlemen. Minaben will be talking to Manubhai in a few minutes, please. Yes? Thank you very much. So just to catch up on the conversation, you mentioned that CyberKnife can also be used for trigeminal neuralgia. It doesn't have to be a cancer. It doesn't have to be a malignant or a benign cancer that you're treating or using CyberKnife for. For just a condition where trigeminal neuralgia, which is a lot of facial pain, whether it's eye, cheek, or jaw pain with the trigeminal neuralgia, is that something that also can be helped with CyberKnife?
Yes, that's the same trigeminal neuralgia, where we see that the jaw pain, the patient will have a severe pain. There's one of the most severe pain which is known to mankind. The people will go to the extent of committing suicide. So
yes.
trigeminal, the CyberKnife works very well. So the use of high dose of radiation with eye precision, we use it like an ablative technique. Trigeminal nerve does not have a facial pain. So in functional disorders, it is very effective. Not only in pain, it also in the movement disorders or some of the psychiatric disorders. We ablate, we actually disconnect the nerves. Basically, we ablate it. And also in case of facet joint pain, in the facet joint arthropathy and pain. To the another extent, we also started using for the cardiac conditions, some of the, like where there is arrhythmia, which is caused by some of the abnormal triggers, we can ablate very effectively. These are some of the non-oncological uses of CyberKnife.
Okay, so I again want to catch up with something that's of my personal interest. So I'm going to ask you this question very quickly. You mentioned about facet joints. Being a chiropractor myself, we deal with back pain and nerve pain all the time. And there are conditions where the sciatic pain is so bad that they need something more than physical intervention. Facet joint injections are given, steroid injections are given, cortisone is given. You are saying that CyberKnife is also a possibility to help conditions like that.
True. So it is as a part of the pain management at an extreme. This one, yes, we can use it even for the facet joint arthropathy and the pain as a part of ablative technique. Yes, it can be used.
Perfect. Thank you for that information. Now, I'm going to encourage the Zoom audience to actually put questions on chat box if you wish to. We will definitely entertain those questions, so feel free to do that. Now, this is amazing. So if I can ask you, can people who are suffering the cancer can say, okay, fine, the cancer has been diagnosed. They still haven't gone for treatment. Can they opt for CyberKnife without going for chemotherapy or radiotherapy and say, I don't want any of that, I just want to go for CyberKnife? Or is it something like you have to go through chemo and radio? If it doesn't work, then you go for CyberKnife? What's the protocol there?
That's a very good question. So case selection, basically, which are the people who are really eligible for CyberKnife. So like this is for everybody. Once the cancer is diagnosed, most of the times you'll be the doctor who is your family physician will diagnose the cancer. The first things what we do is they doing a biopsy to confirm what type of one. So if you see any cancer process of the management of cancers, I divide into three divisions. One is the diagnosis part, one is the management, and then is the follow-up. So these all three parts are very important. In diagnosis, two things are important: correct pathology, and we have many molecular testing, including genomic testing, which is very essential nowadays to give a practically the good roadmap for what type of medicines to use, what is to be used. Then you require a proper staging. The staging is important. The staging means like it may be a tumor is limited only to one area or it has spread to any other area. This is very essential. There's no hurry in cancer management. There are very few conditions where which require an emergency care, where in that case, sometimes even biopsy is not required. Otherwise, there is no hurry, no need to get fearful and think that, okay, it is an emergency and you need to get it surgery tomorrow. So it's a very, very rare in situations we do like that. Otherwise, 99% of the time, you have a full time. Do a proper investigation. Once is the biopsy, and the second one is the whole body PET-CT scan. The whole body PET-CT scan and the MRI, if it is required, it will stage the disease properly. When you stage the disease, according to disease stage, we have a surgery, chemotherapy, radiation, and biologicals or immunotherapy. These are some of the things as a doctor, we have a case discussion with a multidisciplinary team approach. We come together and discuss each case. Simple example of a breast cancer. I'll give you three examples. One is a breast cancer, one is a prostate cancer, or it may be a hepatobiliary or a brain tumor. In a breast cancer, there's no emergency. Number one, your aim is to do proper treatment with an organ preservation, functional preservation, or the preservation of the life. These are the three categories we will do it. We'll do a biopsy and do a proper investigation. If it is limited, in breast cancer, you require surgery, you require chemotherapy, you require radiation. With organ preservation, there is no need to chop off the breast and say that it has to be removed. So in these cases, all three is required. There is no need of jumping into CyberKnife. In the same case, if the tumor is spread to other place, then it is, if it is like the breast cancer with the brain metastasis. That time we do the CyberKnife to the brain or to the bone, including the breast sometimes, and continue chemotherapy. So in the other situations where prostate cancer, you have an early prostate cancer, we have an option of doing surgery versus CyberKnife. Surgery has its own problem. You can opt for the CyberKnife upfront without any problem as a monotherapy. So CyberKnife is used in that very well. In brain tumors, if it is a meningioma or a benign condition, including the malignant, if the patient is like eligible, we do sometimes the surgery followed by CyberKnife directly. Otherwise, without the surgery also, we do CyberKnife directly. In case of liver cancer, like we can do CyberKnife directly, followed by chemotherapy, biologicals, and immunotherapy. So this case-to-case basis, we need to do it. And if the patient has treated already and the tumor comes back, that is the time the CyberKnife works. Even in those conditions, CyberKnife works. A pancreatic tumor, the patient doctor says surgery or surgery is not possible as possible. The patient says, I don't want surgery. Is there any alternative? Yes, there's an alternative. We can consider for CyberKnife in this case.
Great. So that's obviously very informative in the sense that you're saying when to use CyberKnife is very, very case dependent. Obviously, certain cases you will opt for CyberKnife as the primary method of treatment, and other times you might consider using other forms of therapy before you use CyberKnife. Now, when other therapies have failed, say for instance, chemo and radio have failed and the tumor is still growing, do you,
Yes.
in your research and in your 13 years of experience, would you say that where chemo and radio have failed, CyberKnife has worked?
Yes, very much. Like the example of a pancreatic tumor also, or some of the tumors where is in spite of chemotherapy and surgery, the tumor starts growing. And we can consider for that. Even in ovarian cancer, you are treated all the things, the tumor has come back and not responding to the tumor. Lung cancer is the best example in those situations. Yes, CyberKnife works. Even in a metastatic setup, we can consider. The conditions, what we call it as a curative treatment and a palliative treatment, or like to give a definitive treatment in the form of locally if it is controlled. The CyberKnife, whenever we are given treatment, it responds to the tune of more than 90 to 95% local response. The systemically, the medicines and the biologicals is to be used. Recently, the common immunotherapy is in the vogue. Everywhere we talk about immunotherapy. Immunotherapy is coming in a big way, even in early cancers, inoperable, operable. We have an option of immunotherapy. According to me, the future is going to be a combination of local treatment with the CyberKnife and the immunotherapy, which is going to be futuristically a game changer in cancer management.
Okay, great. Thank you for that information. There are a couple of questions that have come up on the chat box, and diverting from our conversation, Dr. Shridhar, we'll take those couple questions from the chat box. We have a message that came from a lady called Nalini, who is a wonderful porter of Minla Zoom. She's the one who has written the lyrics to the song that introduces Minla at the beginning, as you saw. So a wonderful counselor who lives in southern part of London, and she has a question. She says, I'm a polio survivor and suffer from acute aches and pains. Is CyberKnife treatment of any help to her?
Come again, what is the question? What is that?
The question is, she's a polio sufferer. She had polio when she was young.
Polio. Okay, polio sufferer. Okay. Okay.
And she experienced,
and she has the pain.
Yeah, so she experiences aches and pains, a lot of them, all the time. So would CyberKnife treatment be something that would benefit her?
As a routinely, we have not done. So I need to examine her and check out that what is the source of pain. The pain may be because of the muscle weakness, or muscle is getting wasted, or if it is anything which is pressing on that. So we need to see and check out and then decide about. So the people have used as an extreme pain management to ablate. So ablative technique. As a routinely, yes, we have not used it, but I would like to go through that and then take a decision. So that is what it's going to be always the first time to check it out what it is.
Great. So we will Sure. We'll be sharing some details on how to contact Dr. Shridhar during the Zoom session. So Nalini Ben, please hold on, and you can have a one-to-one chat with him at a convenient time, mutually convenient time that you can decide. The next comment that has come up from a gentleman called Vinod, and he says, for meningioma, neurosurgeons have declined CyberKnife or Gamma Knife and radiation, but recommended physical surgery to remove the tumor. Headaches, dizziness are acute. So yes, so he makes this comment that for a meningioma, the neurosurgeons have recommended a removal. Obviously, I'll let you address that issue, Dr. Shridhar, but from my opinion, if the tumor has gone very large, there is no other option but to remove it. Correct?
So what I suggest is, unless we know the patient or know the images and correctly, it's very difficult to give an opinion like that. What I'll suggest is, so you can send me, like, even my this one website is there, Dr Shridhar PS oncologist.com. You can check in and also send me the details. Definitely, I'll look into it and do it. If the patient has the symptoms, if this 3 centimeter and above, easily accessible, surgery is one of the best choice. Why surgery is the best choice? If you remove physically completely, There are newer drugs on the basis of the pathology. We'll get a correct pathology, and then we can treat better. If it is removed completely, no further treatment is required. If it is an incomplete treatment, our patient does not want surgery, and we need to see. And third, alternatively, cybernetics is yes, we do in some patients where patient refuses surgery, not fit for surgery, we can consider for cybernetics.
Wonderful. Thank you. Thank you for that comment, Mr. Vinod. I appreciate that. A very good question from Dr. Amrita Sharma comes in and says, are there any precautions a cancer patient has to take after cyberknife therapy? Wonderful question, because that is a question that was on my list, Dr. Amrita. So I will take it up from here. Are there any precautions a cancer patient has to take after cyberknife treatment?
Like there's no specific precautions like after surgery we take like do's and don'ts. So do's and don'ts is there is nothing. One of the best quality of life what you get it in any treatment is probably the cyberknife. There's some patients very minimally 90-95% of the time nothing happens. Very minimally in single digits people may have a little bit of tiredness. We take a lot of X-ray for tracking. So continuous tracking, that is because of that patients feel a lot of tiredness. So drink plenty of fluids, that is important. And treatment related, other than the tiredness, we have not come across. Very specific to the area, there may be burning micturition if it is in the bladder or the prostate if it's treated. And some people experience the ECOGs. Liver patients feel little bit of loss of appetite. Otherwise, in majority of the time, they all feel good. And in fact, they start feeling energetic because like the appetite increases, the tumor starts shrinking, they feel more energetic, they feel light in this case.
Thank you very much for sharing.
As a general principle of oncology, I suggest that drinking plenty of fluids or like eating well in like as a recovery period makes a lot of difference in this patient.
Wonderful. Thank you. Thank you for sharing that. Dr. Shridhar, the next question would be something that also I had in mind, but one of the viewers had posted it on the chat box. So the question is about pancreatic cancer. We know pancreatic is a very radical cancer. From diagnosis to death could be anywhere from 2 to 6 months. And a very, very radical cancer that can just take you very quickly. So the question is from a gentleman who's a keen supporter of Minla, once again, Mr. Hasmukh Radia, and he's logged in from Nairobi, from Kenya. And he says the Apple CEO suffered from pancreatic cancer. Was this technology available at that time? And if it was treated through CyberKnife, would he have had a longer life? Or is it totally curable? We know pancreatic is a very radical cancer. It takes your life and leaves you alone after that. But the question is a very interesting one. So if you can address that, please.
Yes. See, pancreatic cancers, as you rightly said, that a very, very aggressive tumors, and literature says 3 to 6 months. There are patients, at least 4 patients from Nairobi itself, they cross more than 3 years now who are treated with CyberKnife. So it depends on the local treatment, how much aggressive, and local control is definitely in the range of 90 to 95%. By biology of the tumor is such that it spreads. The medical oncology or oncological medicines are not available much. The response rate is only 30 to 40% for the chemotherapy. So, but if the local control with the CyberKnife, I'm telling you, Vizarv is within early stage, it's safe. So it's a curative in nature. I will strongly recommend that it's like combination of CyberKnife and continuing the medication with a newer. We do genomic testing also nowadays for BRCA testing in these cases and use the medications accordingly. Pancreatic tumors in our series of around 80 to 100 cases. So our definitely patients have survived more than 2 to 3 years. One of the longest survival, what I have right now is at least around 10 years.
From pancreatic cancer?
Yes. So here I would like to tell a story actually. Like it's very simple. So every cancer patient, I always tell a one report changes the life. A one report of the pathology, it disturbs everybody,
Correct.
changes everybody's life.
Correct.
So the patient is in a shock. The story goes like this. This is in 2011. Yeah, it's just 12 years now. So 2011, so the one guy is actually the typical Indian middle class family. He has just shifted to US, got married. When he come back, like the wife is expecting 3 months pregnant,
Oh my God.
and when like his mother is supposed to be shifted like as a 6 months going there and do it. So he just got a general checkup. She was unwell and diagnosed as the pancreatic cancer. Same very clear, shattered, came to me, and actually they tried to do the surgery, but it was inoperable. Then they came to me from Kerala, and everybody told 3 to 4 months. So here the only wish for him is my mother has done everything to me. Is a single mother. So like this is the time I wanted to take to US, and I wanted to show what it is. And at least I want for another 6 months to 7 months so that she can see my kids, and then like whatever let it happen. So we treated effectively with the cyberknife and continued chemotherapy, and delivered, saw 1 year, 2 years over. After 3 years, she had a one lymph node metastasis. We treated that also, and she is absolutely fine. She is 11 or 12 years. So this is some of the successful stories. Here I would like to tell 2 points. Never give up. You need to treat effectively. You don't know what is the future is going to be. Give proper treatment and a proper side. Number two, we always look for something like a curative. Cure is different for different people. I will prefer to tell it as a goal oriented. Our satisfaction of seeing the grandkid is only goal in her life, or it is that particular time. The goals can be extended. The goals can be postponed. I always tell that take the goalpost to the as low if it is end point is the death, or like make sure that the goalpost has to be pushed as far as possible. That is what is the oncological principle I follow.
I think you've touched a very, very, very important part of health and healing in terms of mindset. No matter what treatment you're getting, if the mindset is positive and strong, the treatment will work.
Absolutely.
Yeah.
Absolutely.
Thank you for sharing that and bringing that to the limelight for our audience, that mindset is so important with whatever treatment we are having. First of all, I'd like to acknowledge Dr. Amrita and Mr. Vinod. Thank you for appreciating the session. Yes, we are truly delighted that we have such a speaker of such high caliber with us, sharing this wonderful information on oncology and cyberknife. So thank you for that. And also, Dr. Bawa mentions that after the cyberknife treatment for liver cancer, and being placed on immunotherapy, injections, and chemotherapy, how long do you continue the treatment? He has taken 16 doses of immune therapy injections at 21-day interval, while chemotherapy tablets daily since June 2022. So it's about a year. So his question is, how long do you continue with this treatment?
Yes. So if you take hepatobiliary cancers, the pancreas and the liver cancers are one of the deadliest cancers, what we can call it as. So now actually any immunotherapy drug, we need to take lifelong. So as long as the tumor is under control, if everything is fine, we're going to continue. What we are planning to do especially for him is at least no tumor increase for minimum 6 months after the 6 months. That means another at least 3 more months we would like to continue. It's a very expensive drug. Then we wanted to shift it to once in 3 months as a maintenance. So like that, at least minimum 2 years we would like to continue. And then thereafter, we are going to follow up at least once in 6 months as a sum of the maintenance. But the standard treatment is to continue as long as possible, as long as everything is fine.
Thank
So
you.
one of my patients with a brain tumor, so he is continuing some of the temozolomide for 9.5 years.
Oh, wow.
The brain tumor. So where the brainstem glioma is considered to be only 6 months. You're a doctor, you know the brainstem glioma is very, very deadly. He is completing 10 years now. He is on and off chemotherapy as a maintenance. If everything goes in well, sometimes the literature may not be supportive because they have not reached to that stage. So I prefer, if everything is going on well, continue.
Well, why not? Brainstem tumors are deadly tumors, just like pancreatic tumors are. So if that patient has survived 9.5 years, this is outstanding.
Yes.
So the results look very, very promising, very good, very optimistic. Tell us, are there any downside of having CyberKnife? You know, everybody glorifies this new way of treatments and it's hunky-dory and some wonderful, positive, optimistic stories. But are there any downsides? And if so, what are they?
So in terms of case selection, we need to be very careful. That is, if it is a too big a tumor or like the multiple areas, we know that sometimes we push the borders as because it's a calculated risk what we have to take it. If the general condition of the patient or if the particular organ is not possible, the risk will be calculated risk what we have to take it. That is number one. Other than that, the only downside is the finance. Little bit is an expensive. Other than the expensive finances part of it, I don't see the very much negative side of the CyberKnife. The finance is a little bit expensive, which is for an international patient, it costs around $10,000 to $13,000 depending on the number of lesions, and it's a very short period, very effective, only 7 to 10 days. But vis-a-vis with finances means cost effectiveness, if it is considered. I'm doing a cost analysis across the African countries with the CyberKnife for like over 5,000 odd patients. I feel that is more beneficial. Okay. Because like if the side effects are there and the patient spend the money to go to hospital and take care of the side effects, versus vis-a-vis with one treatment, no side effects. So in the long run, CyberKnife is a better option.
Sure. I was going to touch on the cost element of the downside, but before I touch on to the cost element of CyberKnife therapy, in your experience of 13 years of administering the treatment, have you had a time or a patient that you've said, no, this is not a patient who will benefit from CyberKnife?
Many times. It is not one time, it's many times we have told. Simple example of some of the primary tumors of the head and neck cancers, or this one, we definitely say, no, there's an established treatment like a breast cancer, we need to go one, see a rectum. These cases definitely we have said no. There are a lot of patients come and ask for that. And recently, one of the patients came with a liver cancer. There's only 10% of the liver was active. So it was not, we said that, no, I don't think so, it is beneficial. We are very cognizant about that. If the patient is not going to be benefited, so we'll tell upfront and say that, no, I don't think so, you should be doing that.
Great. So that's a very fair and a very fair comment, very honest comment. I believe, Mr. Radia, your question has been addressed into the costings of it. He's asking a question where we can touch on it again. Is where are these treatments being offered globally? Where are the centers? And in terms of costing for having CyberKnife, what are the approximate costs? And with this conversation, once you've answered or addressed these two questions, we'll take on Mr. Manubhai Chandaria, because this is where he fits into this particular topic. So first question, you've said 10 to 13,000 US dollars for a course of CyberKnife. Is that correct? Can you expand on it more, please?
Yes. So this is manufactured in US. Accuray is the company. It is, I think, 100 and odd number of installation machines there across the world. And actually, in many, like, in fact, the UK and Australia got the cyber knife after we have got it actually in India, because yes. So the number of centers in whole of Africa, actually recently, the Kenyatta University, KU, has got one new. It is still in the installation. It is not started. In HCG, in Bangalore, in India, we have around 8 centers. In that, 2 centers are from HCG. We have one in Bangalore, one is in Mumbai, in Colaba, under us. And the cost of, in US, the same cost of the treatment is 60 to 65,000 US dollars. Same mission, same cost. Even in India, we have to give the import duty, and we are doing only for 10,500. It requires a PET scan, it requires an MRI, and the 5 days of treatment, 5 to 7 days of treatment. The whole thing, all these investigations are also included and make it as a one package. We are looking for a number of patients which get the number game. So otherwise, this actually is very economical. I think Dubai also have it. There also the cost is very, very expensive in that way. And the experience part of it, probably we have the highest number of cases and the experience. And so if it is a retreatment, and if financially, if the people have an issue, we do that is the service as a curative intent in some patients. We have done it as low as possible. At least for 3-4 patients from Nairobi, I've done it free, in fact. So we are told that to take the airfare and the other things, and you please wear within that is a curative image. It is flexible.
Wonderful. That's very good. I hope that answers your question. And this is where we bring in Mr. Manubhai Chandaria. Mr. Manubhai is currently based in Kenya, in Nairobi, and he had a couple questions about having the cyber knife being associated with one of the hospitals. Is that correct, Mr. Chandaria? Minaben, if you can spotlight him and unmute him. Great. Manubhai, welcome on our session. And Dr. Shridhar,
How are you, Manubhai? Yeah.
Hi. Minaben, hi. Dr. Lalit, hi.
Pleasure to meet you again.
When I saw your ad from the Minla, we have started supporting the cancer hospital in Kenya. The first hospital we set up.
Kenya cancer.
No. First one.
Everybody else, please. Can we mute everybody else except Dr. Shridhar and Mr. Manubhai? There is a couple people we're getting, because they are unmuted, we can hear them.
Yeah.
Sorry.
The first one we endowed was at Moi Referral Hospital in Eldoret. And there's a Chandaria Cancer Center. The second one we endowed is at the Kenyatta University Hospital, where the cyber knife is one unit which I was very surprised to see, because that's very modern, but they've already installed that. The hospital is brand new. It's probably the second largest in Kenya. It was built by China as a present to the government of Kenya. It has 600 beds, and now they're adding 200 beds for cancer patients. And there they've got a full comprehensive, so they will be called Chandaria Comprehensive Cancer Center. And they've installed the first cyber knife in the country. They say that this is the only cyber knife. They think that north of Kenya is the only cyber knife available. I don't know very much more about it. I've been and seen it, but I've not asked very much. But when your discussion came up, I told Dr. Lalit and Meena that, look, there is a cyber knife available in Kenya. And my first was to let you know, number one. Number two, what are the possibilities of connecting yourself with the university hospital over here so that there would be a possibility of training, if there is a possibility, because we've done training in number of other areas with India, not only for this hospital, but number of other hospitals, specifically the Seven Hill Hospital and Kenyatta University Hospital. They got a PEX, and all of them visited number of times here. And if there's any issues, I think they're being referred to them. But this being the first time and the only unit in Kenya and Eastern Africa, and probably north of Kenya, north of East Africa. So I thought that might be a good idea. I don't know very much more about it, but there is a cyber knife equipment here, and it's a who provided, no idea, but we certainly I can get some more information and connect to you, both of you, so that there could be some possible help each individually, either in training or providing what to do.
Manubhai, thank you so much for that. That's outstanding work that you're doing, philanthropic work for helping the community at large in Kenya. So obviously this is a very interesting topic where we want to introduce CyberKnife in a hospital and get it connected for training, for performing, for administering the treatment. So obviously a wonderful question. And I think for the benefit of the audience also, and for your benefit, I think it would be a great thing that if you guys connect on a one-to-one and discuss the possibilities of what can be done there. Would that be okay, Manubhai?
Yes, absolutely, absolutely.
Dr. Shridhar, is that okay with yourself?
Yes, Manubhai, I've met you before also. I'm known to Kenya for last 12 years. This is the 13th year I'm coming to Kenya and East and West Africa continuously. And definitely, so one of the main intentions of the coming to Kenya is through some of the patients which we treated with CyberKnife, like the Mopai sisters or triplets. They're actually the singers. So these are the ones who are actually inspired us to come and do it, and we are coming continuously. And MP Shah, CCK, where we are, our center is already there. And some of the SBRT work we can do it, I'm already doing there. So most welcome, and I'll be happy to be a part of it, and definitely associated with KU University and take it forward for the patient part of it.
When is your next trip to Kenya, Dr. Shridhar?
I should be there. There's a conference on 21st and 22nd. Every month I'm there usually. So this time I'll be there on 21st and 22nd of June. I do conduct camps, we do training, and we do give consults. And every patient which he requires, which cannot be come to here, we can definitely treat there locally. So they can always contact me. I have a Kenya number also. Anyway, we'll share the number, and my website is also there, drshridharpsoncologist.com. You can always connect, and it's whatever the help is required, we can do it.
Sure. So we'll do two things, Dr. Shridhar. If you don't mind sharing that Kenyan number, if that's okay with you, and your website on the chat box currently, if we can do that. And secondly, when you are back in Kenya, I believe 21st, 22nd of July, not June. Is that correct?
July, sorry, yeah.
July. So of the 21st, 22nd, if we can put you into connection with Manubhai, and you guys can liaise with the future of what he wants to, what his vision is that okay with you?
Absolutely.
Manubhai, is that okay?
Very, very fine, very fine.
Perfect.
If you're coming every month or every now and then to Kenya, you're very much welcome.
Yes.
Have a cup of tea with us, and we can discuss it. I can call the people then and organize a visit to the center so that you have a look at it.
Perfect. That's very kind. We'll connect both of you. Meenaben can exchange numbers with Dr. Shridhar, with Manubai, and off we go to help the community at large. Thank you, Dr. Shridhar. You put your website on there. That's very kind. It's on the chat box. We have a gentleman who, and your phone number. Thank you very much for that too. Ladies and gentlemen, if you're on the chat box, please grab the website. Please grab the telephone number for Dr. Shridhar. And one thing is, let's be very professional about this. He's very kindly shared his number with us. Let's respect his time. Let's not call middle of the night because of different time zones. This guy is working very hard.
Always what best thing to contact is the WhatsApp.
WhatsApp.
Or actually, that's and go to the website and give it. I'll give my Kenya number also.
Yes.
And here I'm seeing that one of my close friends from other part of the West Africa, Dr. Olalade, he is also an oncologist.
Yes.
So like it's happy to see him, and we are together. We are grown up together, and he is in one of the ministers. He is one of the directors in one of the hospitals, Dr. Olalade. So good to see you, Dr. Olalade.
We can probably give a spotlight to Dr. Olale. And before we do that, I also want to acknowledge Mr. Vinod, who said a very wonderful thing about being treated with any treatments. It's the biology of belief. I thought that was a very, very nice comment, Mr. Vinod. Thank you for sharing that. If you believe in it, it will happen. What you think, you manifest. So it's a very good one, biology of belief. Thank you for that. Dr. Olalade, I believe if we can spotlight you, that would be good. Yes, we are fast approaching towards the end of our session, but before we let you loose, Dr. Shridhar, a few quick questions I have over here. If you were to say better or not, is CyberKnife better than radiotherapy, chemotherapy? Once again, I understand it's case specific, but as a rule of thumb, would you opt for CyberKnife first?
Yes. So treating with the SBRT, CyberKnife is a better option than continue the further treatment, because when you add chemotherapy first, sometimes the conditions may go down and complicate. So upfront treatment may be a better option in most of the tumors.
Perfect. The next question goes to, with chemo and radiotherapy, there's a lot of hair loss, skin irritation, weight loss, things like that. Does something like this happen after CyberKnife?
No, the CyberKnife does not have any disfigurement to the body is not there, because, so I didn't explain totally about that. If you take an example from the tumor side, the surrounding structure, the dose call is within 3 to 5 millimeters. This 90% of the dose call occurs within 3 to 5 millimeters. So that means the accuracy of treatment is very well. The surrounding structures does not get much of radiation. Because of that, the quality of life is good, side effects are less, and the effectivity of the treatment is more.
Very good. Thank you for sharing that. That's very kind. In terms of the efficiency or how quickly CyberKnife will work, any comment on that?
It's a case specific.
Yes.
It happens to the different. I've seen some patients, especially media channel. I recently treated one of the gentlemen. We were treated for Ewing sarcoma for 3-4 lines of treatment. He was not able to lie down. He was having a breathlessness. There is a big mass here, media channel mass. So we treated under a little bit of a sedation. He was having pain. By second or third day, he felt far better. And we have seen that as early as possible, one fraction. So I've seen that some patients, but majority of the time it takes 3 months, 2.5 to 3 months. But it may start working as early as possible with single fraction.
Perfect. Now, one of the questions that has come up to me on a WhatsApp message over here on my personal phone is that, okay, so the cost of a cyber knife could be up to about $10,000 to $13,000, and it's for a one session or a series of sessions.
Full,
Does that work?
full treatment.
Full
That's
treatment,
5 sessions. Yeah.
5 sessions of that treatment at that cost. Now, if everything goes well, one may not need it again. If somehow the cancer relapses and it comes back and they need a further, or they decide to have a further course of cyber knife therapy, how would that work in terms of costing again?
So very simple. In this 3,500 cases of odd cases, what I have done, the local recurrence is only around 15 to 20 cases I must have done.
Wow.
So whenever it has happened, we always we may do it for lesser cost, around 20 to 30% less than what it is, around $7,000. We do it $7,000 if it comes in the same place. I would like to tell you, the finances is not really should be the one of the things which is going to guide this treatment. No, we are very flexible in that nature, and I'm thankful to all my team and Dr. Ajay and the CG part of it, where we have seen that those things will be taken care case to case basis.
That's very kind of you. Thank you for sharing that once again. And last question I had over here is, oh my God, that question disappeared from my messages, but I'm trying to grab it from, great. Yeah, the question that came up actually was the difference between, a very short description between cyber knife and gamma knife. What's the difference there? The radiation, or is there any more difference there?
Both are radiation. That is number one. Cobalt is there are 201 sources, but are there, and actually we need to fix it. We fix it with the physically the fixator, and you need to lie down on that. And the size of the lesion is a problem in case of gamma knife. Usually we don't do more than 20 or 30 cc, and in case of cyber knife, there is no size constraint. In gamma knife, usually more than 20 cc, we don't do it. So that is one of the things, and the fractionated. The fractionated cyber knife, because we give 5 fractions, more than 1 fraction, it's easy for the patients to be, the effectivity of the treatment is better. The single fraction is in gamma knife, we do only single fraction. So sometimes it is detrimental. So I work with all these machines. So it may be with the X knife, gamma knife in AIM, and X knife in All India Institute, and then with the cyber knife. So here we don't give margins, extra margins. In the normal situations, we give extra margins. That is one of the things which makes it more treatment-related side effects. I've done a lot of work in brain tumors in those areas, which has definitely made a difference. Initially, we thought it's only 12 to 14 months or 18 months of survival. With these approaches, with extra innovative ideas, and the survival has reached to 3 years, which is one of the longest survivals. What we are talking in the brain tumors, as I told, 9-10 years is surviving. So those are all some of I attribute for the higher doses, and believing that treating probably with a proper ablative techniques in case of cyber knife makes a difference.
Thank you for sharing that information. We've already gone about 5 to 7 minutes above time, Dr. Shridhar. That's very kind of you, a very interesting and a very stimulating conversation about oncology and cyber knife. This has been truly, truly an informative session, and I'm sure the audience agrees to that because of all the chat box messages that we've had. They found it very interesting. So once again, a massive thank you. We move on to the next part of our Minla Zoom session, which is our very, very, very popular and a very rapid fire round. Are we okay to play a rapid fire round, Dr. Shridhar?
I'm excited. It's always the rapid fire rounds are the best one.
Well, thank you very much for that. So I would like to say welcome to the Minla Zoom session rapid fire round with Dr. Shridhar. Dr. Shridhar, the very first question is, The questions are going to be quick. The answers have to be even quicker, if I may say that.
Okay.
So the
Okay.
very first question, cyberknife therapy.
So it's one of the best treatments available as per now for the cancer patients, and it is a game changer in oncology.
Thank you. Jain diet, diet that is with Jainism in mind. Go ahead.
So the autism, like if you want to be healthy and productive, it's always follow the sun, sunrise to sunset, and they follow the Jain diet, probably one of the most preventive and time-tested diet what we can have.
Thank you. The compound, very popular, turmeric.
The turmeric is, again, go back to the time-tested things in Hinduism, like everything starts with the turmeric. You actually, you put it, you eat, that is the best antioxidant, anti-inflammatory known to the mankind, and best anti-cancer. So if you want a preventive aspect, one kit like turmeric is definitely the one which prevents a lot of things.
Thank you. From an oncologist viewpoint, which is the worst cancer one can get?
See, the melanoma. Melanoma is one of the incurable cancers, and which is independent. It has nothing to do with your lifestyle. So other than that, like the worst cancers, what we can do is some of the sarcomas are worst cancers. Initially, we thought that kidney cancers is the worst, but no, all other cancers can be manageable. Melanomas are the worst cancer to get.
Okay, we'll stick to a one-liner or a one statement if you don't mind. Otherwise, the answer
Yeah, fine.
That's okay. Top three foods to avoid.
See, I'll say three like white salt, white sugar, and white carbohydrates. That is rice.
To avoid.
Avoid, yeah.
Okay. What are the top three carcinogenic chemicals to avoid?
Tobacco, definitely tobacco, alcohol, and any of the other chemicals which is stored food chemicals are definitely carcinogenic.
Thank you. Best university for studying oncology as a specialty.
Sorry?
Best university to study
Best
oncology.
So Tata Memorial All India Institute, AIMS, New Delhi.
Okay, wonderful. That's where you came from.
Yeah.
That's good. So on a lighter note, your favorite, idli, dosa, ya uttapam?
Idli is the best balanced food made, idli.
Okay. Your favorite holiday destination, Dr. Shridhar?
Oh, I'm looking for Mars. They're not yet opened it.
Ah, nice one. Let us hear your answer for top three reasons why cancer can happen.
Why cancers can happen? See, body, you told that sound body, sound mind, and this one, like it's connection, mind-body connection, soul connection. You should increase your immunity. That is the best thing to do it. Be like, don't have a sedentary life. Like, do increase your immunity. That will take care of the rest of the day.
Thank you. Fast foods, good or bad?
Absolutely no. Bad.
So burgers, vada pav, dabini, no good.
No.
Oh dear.
Anything boiled is okay.
Okay. Social media. What do you think about social media?
You need to make it to your kind. That's what we are. We connected and use it for a proper platform.
Thank you. Has COVID had an impact on cancer?
Not really. COVID has, but COVID has taught a lot of things to us. Nothing to cancer.
Okay. What do you recommend as an oncologist? A vegetarian diet or a non-vegetarian diet?
So balanced diet. I'll put it as depending on your one balanced diet, veg, non-veg does not matter. Seasonal fruits, seasonal vegetables has to go as a part of your diet.
Thank you. What country practices cyberknife therapy the most?
Probably India right now or in US. I think India is the number one.
Okay. Your favorite Bollywood actor?
Other than the Amitabh Bachchan, like it's
The evergreen. What
evergreen.
inspires you about your work the most?
Every day in the morning when I get up, like that one particular patient which I'm not able to complete and say that this comes and smiles and say that I'm fine. So that inspires and always makes me to go.
Thank you. The sport, scuba diving.
Scuba, that's my passion. That's my dream, and I did. That's the passion. That's a different world. Underworld is okay. I'll take 1 minute here, 1 second, one sentence here. See the world. Everybody told the world is beautiful. The underworld is still more amazing. The inner world to experience is to explore the universe.
Wow. Wonderful. Now, the next question is restricted to one statement from you only. What does the name Dr. Monica Gupta mean to you?
I think she's online. We'll see. That's
So
my life.
you better use the right statement at this time.
That's my life, like lifeline.
That's your lifeline. Wonderful. Okay, last question. What did you think about Dr. Soda's rapid fire round?
Soda is like, see, it is such a lovely and inspiring.
Thank you. Thank you very much, Dr. Shridhar, for participating on the Minla Zoom session rapid fire round. This session has been absolutely amazing. Lots of good information, lots of food for thought, and lots of encouragement for patients who are going through cancer or suffering through cancer. So once again, thank you from Minla, but I will let our lady, Mrs. Meenaben Khagram, to do the formal vote of thanks for yourself for this Minla session today. Meenaben, spotlight yourself.
Here. Apariya Joni to all. This is my pleasant and humble duty to end this session with the heartiest thank you to my kid brother Kirit and Sandhya for make this session happen. Thank you, beautiful souls, those who are watching on Facebook Live and those who have logged in live on this session. Can't end my thank yous without saying big thank you to my cute cousin, Dr. Lalit Soda, and our co-host, Ellie Pai. Thank you all. Asandi Sana, Kwaheri, good evening. Stay connected for next 5 minutes. You can speak one-to-one with doctor.
We also, Dr. Shridhar, we also had a gentleman from Dubai who had logged in for a while and he was listening to our session. So wonderful. I think we've had such an amazing session with oncology and cyber.